has mid-stage dementia, and I am a primary caregiver as well. And I would like to support Bruce's comments about research funds on the data that he presented. The other piece that I think should be a rather powerful motivator is we estimate that over the next 40 years we'll be spending as much as $20 trillion just for care of Alzheimer's. It's nothing to do with cure, but just for care. If we don't change that, we watched this little circus going on in Congress a few weeks ago where we're trying to save $1 or $2 trillion. This will literally bankrupt us as a country, and from a single disease that really is not acceptable. So the need for dollars in the research is really paramount. And I would like to make one other comment as far as caregiving is concerned. One of the things that is solely limited is access to care on a community basis that provides care to folks who are trying to care for their loved ones and to keep them in a home situation. Care that involves direct care for patients that is really not available outside of an institution. And one of the things that I think the federal government can do, and certainly we can do locally, is to provide funds for enrichment programs for patients living with Alzheimer's disease, especially in mid to late disease. And one of the things we've done personally is start our own family foundation specifically for the idea of raising funds to provide care, provide funds for art care for Alzheimer's patients. So this will give them an opportunity to socialize, remain active in the community, and hopefully be able to remain in a home situation a bit longer. But the need for research funds is really paramount in this whole process.
Jeez. We talk about funding research, but to be able to successfully do research, we need people for clinical trials. So let me raise awareness for you all that we need people in all walks of life, in all stages of their health, to look at Trial Match on our website and sign up. If nobody is signing up for clinical trials, Bruce can only do so much with the mice. So, let me add that.
Yeah, let me just add my piece on this research, because the numbers I hear are kind of scary. When I hear how few projects get funded, and I hear what the cost of care is and what it's going to be, it's kind of a no-brainer that if you invest money today, you're going to save Lord knows how many trillions of dollars down the road. And I think that's where Congress is being very short-sighted. The story I always tell people, when I was growing up in the 50s, polio was the big thing. And I had polio. But I don't have to worry about that for my children or my grandchildren, because some bright minds did the research and found the answers. And I've got to believe the same is true for Alzheimer's. I mean, my father had Alzheimer's. My mother had dementia. They never determined whether it was Alzheimer's. But I don't want my children to go through that, because I consider myself a prime candidate to get Alzheimer's, given my family history. Somehow we have to convince Congress. I mean, if you went to any business and said, you know, give me $1,000 and I'll save you $100,000 in 5 years, you get a check immediately. Congress doesn't act that way. They look at this year's budget only, and they don't look at investing for the future. We somehow have to change that dynamic in Congress. My fear is that given all of the cutting that's going on in the federal budget these days, that the research dollars are going to suffer even more, and those are dollars that can least afford to be cut. Somehow we have to get that message to Congress.
I can just add to that, Ken. I think what we need to do as voters is put the message very clear to our elected leadership. Put the dollars where they need to be, which is in research, which is instrumental to finding a cure, It's also instrumental in helping those who are not only afflicted but their family members, or will find new elected leadership in order to make those decisions for us. Because we all acknowledge here that any business in America would make that decision. And we need our elected officials to step up to do the same.
Hi, my name is Janet Barron. My father has been diagnosed with dementia. We're not even sure at this point if it's Alzheimer's. I feel like the elderly are being kind of warehoused in the whole medical realm of things. We seem to have a hard time getting doctors to coordinate on his care, getting any real information that we need regarding next steps, medication. I've been bouncing around a lot without any real specific plan of care.
I think what could be done as far as the doctor's visits that I used to use on a professional level is when they came into the community. Dr. Campbell, Dr. DeGolia, we used to call them. We have someone here on this street, because a lot of times you can't get them to the doctor, particularly in the African American community. They don't trust you. You know, there's always something going on within the family system. So if we had more physicians that would be willing to come out, it was an excellent, I don't know if they're still doing it. I use the University Hospital's home care unit that comes to my home. They do that about every 3 months. But again, I'm a professional, so I know the resources. How do we get that out there?
Let me echo the compliments that she gave to the Alzheimer's Association, because right now I think their website is very good, and that's one way to get things out there. I'm not saying you're being successful or anybody's reading it all, but something like that, and promoting it as much as possible. What I was going to say for your specific, right now the Alzheimer's Association has, through the grants from the state of Ohio, are respite programs, and it's hard to describe, but just think of this person who, in the support group, who was just really having a hard time dealing on a daily basis with her husband. She was just trapped, if you will, no abuse or anything, and the smile on her face when she came in, having been given a break by the program, I don't know if it's respite, but the program where she could take him to sort of an adult daycare. Now, it's difficult to get many of them there, but just so she had a free 4 hours. I think in terms of bang for the buck, for caregivers, you asked me earlier, that might be it, just because it can't cost that much for those few hours.
The respite line item current budget provides, the association corrects me, I believe it's $200 a month, and there's a process to apply for it. There isn't nearly enough funds to cover all the people that are applied for, but it's really to try to help keep the patient at home with the caregiver versus having to go into an institution.
Well, no, I know what it's used for. I just wasn't sure. I mean, I've worked with some people in our office that have used adult daycare, and at the time, it was a couple of years ago, and at the time, I don't think it was covered completely. And I guess my question, just because I don't know, and that might be something that legislation could address, is if adult daycare is covered by insurance. Okay, so that's what I needed to know, because that's something that you might be able to address with legislation.
I'm sure Bruce can speak to this much better than I, but in speaking about research and getting people to get themselves involved in research trials, there is a whole new movement over the past, certainly year, of early diagnosis of Alzheimer's disease done radiographically and serologically by testing spinal fluid, blood, different radiograms. There's a debate as to whether this should be done because Alzheimer's can't be treated. On the other hand, if we can identify folks who are highly likely to get Alzheimer's disease 30 years before the onset of the disease comes on. People like Bruce and research-oriented groups can start folks on trials that are early enough and see over a period of time whether they really make any difference. It's pretty well thought now that when people become clearly symptomatic of Alzheimer's disease, they're probably beyond the point of being treatable. So it's really very important that this treatment start early, and if we could fund the mechanisms that are now available to diagnose Alzheimer's early, that would be very helpful. The waters are kind of muddy as to what should be done, but certainly as a direction to be extremely helpful for the research efforts.
If I can piggyback on what you just said, also, when my wife was finally accepted into the University of Pittsburgh Alzheimer's study, after we knew she had the gene, and Dr. Bill Klunk is the one that invented the Pittsburgh compound B, and that's the dyes that are used. And when we got our PET scans back, he told us, we sat there and we talked with him and everything, and he said that he would have seen the onset of this in her early 20s. Not that anything could have been done then and everything, but he would have seen it 20 years beforehand. So.
He's just rendered me speechless. So we talked about physicians, and I think there's two pieces that need to be part of the legislature. And the first is a way to incent medical students to go into geriatric medicine. It doesn't pay for physicians to do that now. So a means of incenting. The other piece that keeps me up at night is when physicians say they don't have time to talk to the patient or their family about the diagnosis because they're not reimbursed to spend that amount of time. So looking at how Medicare, Medicaid, and the insurance organizations reimburse physicians to ensure that patients aren't left hanging with just a prescription in their hand and nowhere to go.
I just wanted to come back what was just mentioned about sort of early diagnosis. And yeah, I think all the evidence suggests now that probably 15, 20 years before, diagnosis, sort of clinical diagnosis, you can see changes in the brain, which I think does give us an opportunity, a unique opportunity to sort of try to get at things. But one of the things that goes alongside of that is most drug companies will not be sort of willing to do these kinds of clinical trials, where you're talking really about almost like a prevention trial, where you would want to start early and stop the disease because it's just too expensive to do. They can't wait 10 years to find out what the result of their experiment is. And the only structure, I think, that can do that sort of endeavor is the federal government. I can't think of any other, or some sort of partnership with with companies is the only way I think that could move forward. And so I think if we really are serious about tackling that and tackling it early, which is I think all the evidence, increasing evidence suggests we should be, then that's again another role that I think the government has to sort of step into if we're going to be successful.
Thank you. Hi, my name is Samantha Brooks, and when we talk about what physicians can do, I think we need to look at education and training for all physicians, especially those, because Gail, I believe, mentioned general practitioners and internists are not paid as well as specialty physicians, surgeons, or someone, or oncologists, or any other doctor that has a specialty. So we can begin to pay those individuals. First, we can begin to train doctors when they are in medical school, because we are never going to get enough physicians that will focus on geriatrics and want to come out and serve only older adults. But many of those physicians, family physicians and internists, do practice and see older adults. But they are focusing more on, is your heart beating? Is your blood pressure lower? or do you have any joint pain? Not necessarily